Health Watch, just under 50% of Americans are fully vaccinated against COVID-19. And as inoculations slow and infections surge, officials are reconsidering what can be done to keep the population safe. Officials in California and New York City have announced all public employees must be vaccinated within the coming months, or else masks and weekly testing will be required. Dr. Dyan Hes is with us now to discuss. So listen, doctor, where you are, this is one of the cities, New York City announced yesterday that they were going to require all teachers in particular to be vaccinated before school begins in September. All city workers, but all teachers. I would sort of think this would be a no-brainer. I mean, one of the concerns that the union was having was that older teachers in particular will be more vulnerable because younger kids could bring the virus in and no one would know they're sick because they're not really showing any symptoms, and that would be a bad thing. So I'm presuming that ensuring that all teachers are vaccinated is something that you would give a thumbs up to.
Absolutely, Anne-Marie, but you have to remember that common sense does not prevail in New York City politics. So,
right.
According to the articles that I've read already, according to the articles that I've read this morning, there's a lot of pushback from the teachers union. The teachers will be subjected, and any New York City employee will be subjected to weekly COVID testing if they do not agree to get vaccinated. And they actually said this is a union city and we can bargain this, and we do not have to do weekly COVID testing and mandated mask wearing if they're not vaccinated. So this is not a cut and dry case, because we do not live in a society that believes in public health and children's health comes first and children's education comes first. So that's my feeling. It's not going to be as easy as they say. I wish it was. In other countries, teachers are mandated, public health workers are mandated to be vaccinated. If you don't get vaccinated, you lose your job. And if you don't lose your job and you cannot be repurposed and you need to get a weekly COVID test, you have to pay €49 in France for a COVID test every time. It's not funded by the government.
Oh, that's one way to ensure that people get the vaccine. That can start to get expensive. So yes. We know that at least currently the vaccines are available to children 12 and over, but both Pfizer and Moderna have expanded the size of their clinical trials for children between the ages of 5 and 11. What are they hoping to discover by doing this?
So currently they've determined that the rate of this heart inflammation has been about 13 cases in 1 million patients who are vaccinated, and they're mostly males under the age of 30. So the current size of the trial they felt was not statistically significant with the children, and to see if there was any more cases of this heart inflammation, this myocarditis. So the FDA mandated that they have to expand their study numbers, and in some cases I hear that this might actually be doubling the patients that are enrolled. I know that there are huge wait lists of children waiting to get into these trials, so I don't think enrolling the children will be a problem. I just think collecting the data going forward is just going to set us back, because it's going to take another 3 to 6 months to get this data.
Yeah. I was one of those parents that I was like, I'm not sure about inoculating, my kid. She's under the age of 12. But boy, increasingly I've been hearing about people who so far have been fine throughout this pandemic, and now they've tested positive for COVID and, are dealing with, we presume, we don't know, the Delta variant. And so I'm increasingly becoming more and more concerned. Dr. Fauci, in fact, recently said that the CDC is considering revising mask recommendations for the fully vaccinated. Do you believe we'll have new mask guidelines before school begins in the fall?
I feel like every day the mask guidelines change, so I do expect something to change. Yeah. My problem with mask guidelines is they're very they're not uniform, right? So, my cousin just told me she landed in Italy and she had a cloth mask on, and she walked halfway through the airport, got to customs, and they said, you don't have a paper mask on. They made her walk all the way back to the airplane. She said it took about 10, 15 minutes just because there was no guideline saying you have to only wear a paper mask to enter. So, we have patients and kids wearing these cockamamie masks with filters, masks like with mesh, what's a mesh mask? So I think that's a bigger problem, that the mask really doesn't do anything because people are not using them properly.
Yeah, that's so true. Particularly when it comes to kids' masks, it's like, people saw sort of a bonanza there and started kind of like cranking out all kinds of sort of smaller masks. But you wonder who makes this stuff. Do they have a history of making masks before today? And is it a good quality? I got to tell you though, Dr. Hes, I keep my mask with me all the time, and I still, when I go to indoor spaces, particularly if they're smaller, I mask up. It really doesn't take much, and if it's going to protect me a little bit, I'm vaccinated, but perhaps I'll protect someone else. It's worth it. Dr. Dyan Hes, thanks so much for joining us a little bit earlier today.
I didn't know you were up this early. Take care.
Yeah.